So again, thank you all for registering and attending on today's webinar. We did have a large number of interest. We're surprised we have so many people on the call with us today. There's about 40 some odd people on the webinar now. We had about over 100 people registered, so I'm expecting people to chime in as we get started. So again, this is a quick run through today's agenda. Let's go ahead and get started with the welcomes. Again, my name is Tony Ochoa. I'm with the Latino Commission on AIDS, and the program manager for National Latino AIDS Awareness Day. I've had the pleasure of interacting and speaking with plenty of you. So for those of you that I haven't met or haven't had a chance to speak to, I look forward to interacting with you in some way or another now, and also through phone calls and communications that we might have hereafter. What I'm going to do now is I'm going to unmute the lines, and I'm going to ask everyone, if you can, just give us your name, give us your agency, and your city and state, all right? So I'm going to unmute your line now.
The conference has been unmuted.
So the lines are all currently unmuted, so just feel free to chime in and give us your name, your agency, and your city and state.
Good afternoon. This is Viridiana Rubio and Juan Gomez from AIDS Arms in Dallas, Texas.
Welcome.
Good afternoon. Hi, everyone. This is Jesus Tarifa and Carlos Negrete from the Center for Community and Justice, Centro de Comunidad DC in Boise, Idaho.
Good afternoon. This is Carrie Mann from Jackson, Tennessee.
Hi, this is Gracie Kemp from West Tennessee Legal Services, Jackson, Tennessee.
Hey, Gracie.
Hello, everyone. This is Edwin Espinel with the Utah Department of Health in Salt Lake City, Utah.
Hey, Edwin.
Hello.
Hi. Brianna from the Health Service Representative from Florida Health, Monroe County Health Department.
Great. Welcome.
Hi, this is Janice Evans. I'm with Missouri Department of Health and Senior Services.
Hey, Janice.
Hey.
Hi, my
Good
name
afternoon.
My name is Catherine Hernandez, and I work in the Wake County Health Department for North Carolina, Raleigh. Thank you.
Catherine.
Good afternoon. This is Lillian Orsini, Florida Department of Health.
Wonderful. Welcome.
Shatora Smith, Harlem Dow and West Side Center.
Great.
Good afternoon. My name is Veronica Calvin, and I'm with the Tennessee Department of Health in Nashville, Tennessee.
Good afternoon. My name is Maria Venegas with the Arizona Hispanic Chamber of Commerce.
Hey, Maria.
Good afternoon. This is Kit Klecko with Aunt Rita's Foundation from Phoenix, Arizona.
Hey, Kit.
This is Victor Palomino with the Western North Carolina AIDS Project in Asheville, North Carolina.
Sure.
Good afternoon. This is DeMarcus Bonner from Latino Commission on AIDS, and I'm from New York, New York.
Hey, DeMarcus.
Hey. This is Anthony Garcia from Philadelphia, PA, from Esperanza Health Center.
Hey, Anthony.
Good afternoon. This is Sharon Morrison, North Carolina, Greensboro Department of Public Health Education.
Oh, hey, Sharon.
Hi, everyone. This is Andy Fine at Marin AIDS Project in suburban San Francisco.
Hi, guys. This is Karina Ramirez from the AIDS Council of Northeastern New York in Albany, New York.
Oh, hey.
Hi, good afternoon. This is Renia Mills. I'm from the Florida Department of Health in Broward County, and that's Fort Lauderdale, Florida.
Wonderful.
Hi, good afternoon. This is Erica Cuello from Florida Department of Health in Miami, Florida.
Hey, Erica.
Mecklenburg County Health Department. My name is Luis Cruz, Charlotte, North Carolina.
Hey, Luis.
Nora Chandler with the Latino Agency in Oklahoma City, Oklahoma.
Good afternoon. This is Pravina Saxena and Alex Barros from the Florida Department of Health in Miami-Dade County.
Hi, this is Gabriel Guerrero from the Latino Community Development Agency in Oklahoma City, Oklahoma.
Hey, Gabriel.
Hi, this is Lisbeth Rivera from Aspira of Puerto Rico.
Hey, Lisbeth. How are you?
Good.
Hi, this is Cynthia Jimenez, Minority AIDS Coordinator at the Florida Department of Health in Lee County, Fort Myers, Florida.
Wonderful. Welcome, Cynthia.
Good afternoon. I'm Deborah Savage. I'm the program coordinator at the Pitt County AIDS Service Organization in Greenville, North Carolina.
Oh, yeah.
Hi. I'm Virginia from Public Health and Wellness.
Hello?
Here. Anyone else?
Hello, you hear me?
Yes.
This is Omar from the Mecklenburg County Department of Health as well.
Great, welcome.
Thank you.
Great, so thank you all for joining us. We have a good number of people on both the phone line, and also the web portion. If you haven't accessed the web portion, again, you can do so by clicking the link, which is in the email you received where you got the conference number. For those of us that are visual learners, you'll see that it'll make it a lot easier to follow through with the content information that we talk about now, with the information that we're presenting. So feel free to view it online. That's what we're going to do it. Let's go ahead and get started. What I want to do is I'm going to go ahead and mute the lines again, so you can notice that when the lines are unmuted, it gets a little difficult to hear sometimes. So we're going to eliminate that from happening by muting the lines, but it doesn't mean that you can't pose a question
has been muted
by using the chat box, or again, if you have any questions throughout the course of the webinar, we'll have certain areas where we'll unmute the lines for questions, or you can unmute your line yourself by pressing *7, all right? So I want to start off by asking you guys a question. So just so we can kind of gauge how many of us are new partners, how many of us have participated in organizing a National Latino AIDS Awareness Day event before. Go ahead and the question here on the screen is, has your organization organized an NLAAD event previously? And you can click yes, no, I don't know. Great, so as you can see, we have a large number of even though we have the majority of people have participated in National Latino AIDS Awareness Day before as an organizer, there's about half that haven't. So again, this information is created in a way where it's going to support you in organizing a National Latino AIDS Awareness Day event. And again, there's plenty of ways in which you can do that depending on your available resources. So currently we have about 39 that have, 39 that haven't, and about 22% that aren't sure whether they have or not. So that's good to know, because again, that's going to help us then craft this in a way that's going to be useful for you all, depending on who's on the call with us. And again, before I get started on announcements, because we have quite a number of people that haven't been involved with National Latino AIDS Awareness Day before, approximately half. National Latino AIDS Awareness Day is a social marketing campaign. It takes place every October 15th. And it's a national campaign, so even though it's a national social marketing campaign, we also think of it as a community mobilization effort, and that it's a collaborative effort amongst ourselves and our partners across the country who host events in commemoration of National Latino AIDS Awareness Day to raise awareness about HIV and AIDS amongst Latino communities, in which we regularly interact with. So again, it takes place every October 15th, and we have generally over 100 some odd events that take place across the country, and we have over 200 partners that we work with annually. So it's great to see that we have such a large number of partners online now that haven't participated before, that are interested in hearing more about Latinos and HIV and how they might potentially be interested in participating in National Latino AIDS Awareness Day. So with that said, I'm going to go ahead and talk now about announcements that we have about the campaign in general before we get started on today's topic. For those of us that were on the call, that were not on the call last time, again, this is the general imagery of the poster for this year, along with the theme for 2014, which is to end AIDS, commit to act, right? Or in Spanish, para acabar con el SIDA, comprométete a actuar. And it's pretty much a call to action for people to really make their individual effort in making their mark to end AIDS. Again, raising awareness can be anything from, learning about HIV to taking the test, or even taking your medication regularly if you're on PrEP or if you're HIV positive and on treatment. So again, there's plenty of ways people can engage in ending HIV/AIDS, and that kind of ties into what the theme is, right? So for those of you that weren't aware, this is the 2014 theme, to end AIDS, commit to act, para acabar con el SIDA, comprométete a actuar, right? A couple other announcements. This year, something we haven't done before is we're going to be posting Facebook ads. So these Facebook ads are going to be directing general community members to go to the NLAAD website and look up events that they can participate in, which is, again, very useful. Another reason why it's very useful and important for partners that are hosting events to A, register on the website as a partner, and B, then also enter their event information on there. Again, that's useful for local community members to know what events are happening, and also for in case media usually ends up calling us and asking, hey, do you know of an event that's happening here in Phoenix, Arizona? And it's very easy for us to then direct them to the website so they can look up what events are happening locally, right? So again, we're very excited to see the type of traction that we get from this at the local community level. We're also doing an NLAAD radio tour where we're having a 60-second PSA aired the day before National Latino AIDS Awareness Day on October 14th. And these are the markets we're hitting. A lot of these markets are large radio stations that have a large listenership of Spanish-speaking Latinos. So the PSA will be in Spanish and a lot of these large Hispanic markets. So we're very excited to have this happen this year again, and it's going to be prompting people to do something in commemoration of National Latino AIDS Awareness Day, and also go to the website to see what events are happening locally. Another reason for you to then also make sure you register and also enter your event information on the website. These are the topics for the webinars and webcasts that we'll be holding this year. Again, the webinars are more crafted to help you in organizing and NLAAD events. So we had our first one on July 23rd, which was around ideas that best fit your local community and resources, so different NLAAD event ideas that you can host. And today's topic, which is the state of Latinos and HIV, where we are and where we want to be. And you can see, again, these webinars are intended for partners to help them organize events, information that's going to be useful for them when it comes to organizing events, while the webcasts are more general information on different topics that are going to be useful for the general community and also potentially partners, where it's going to be a webcast panel, and it's going to be a live video stream that people can then view online and also engage with us via Twitter. So those are general announcements. If anyone has any questions, feel free to type them into the chat box. Or again, if at any point you have a more customized question that's more directed towards your organization or a particular event that you're organizing, you can always contact me directly over email or phone. And you'll have that contact information on the end of the slide that I'll be showing in a minute. So we're going to get started. So what I'm going to do now is we're going to start talking about Latinos in the United States and territories. So this information is largely pulled from the Census Bureau data. So some of this information might be from the most recent census, but some of this information is also pulled from the American Community Survey. So it gives us a very holistic understanding of what Latinos look like, and I'm using Latinos and Hispanics interchangeably throughout the course of the webinar, FYI, but it really helps us understand what's going on across the country, right? So as a whole, Latinos are the nation's largest minority group and among the fastest growing populations. According to the U.S. Census Bureau in 2013, again, this is a bit of information that came from the American Community Survey, the Latino population in 2012 was 53 million, making up 17% of the U.S. population. So again, we're a very huge percentage of the U.S. population, and we're very fast growing, right? So, which is why you might hear a lot of, especially in policy, and especially around the realm of business, a lot of people are really trying to make their way in with Latinos because they understand this figure, and we're actually, we were a big prominent population when it came to the recent election of Obama, right? We were showing that we came out to vote at very record high numbers. So we're getting a lot of recognition lately because of this reason. So this is what it looks like at a national level. As far as the top 10 states with Hispanics, you'll see them noted here. The top 10 states with Hispanics are California, Texas, Florida, New York, Illinois, Arizona, New Jersey, Colorado, New Mexico, and Georgia, right? And the highest, again, being California. But it's important for us to realize that there's more than just looking at information about population size. You want to make sure we understand where and what areas in which the Hispanic Latino population is growing at a faster rate. And you'll notice that most of these states are where? They're in the South, right? So this is important to note because what we're seeing lately is that there's a lot of organizations and partners that we have within the southern region of the United States that are asking for support around how to better meet the needs of Latinos in the South because it's a very fast-growing population there. So it's important to note that, yes, where the Latinos and Hispanics across the country are predominantly targeted in very key 10 states that we saw in the previous slide, but Hispanics and Latinos are actually growing very quickly in the southern states. So it kind of gives us a glimpse as far as migration patterns go and also growth rates of Latinos and Hispanics across the country. We also want to take into account that, when we say Hispanics and Latinos, it's important to understand that we're a very diverse population. We're not just, we're not very homogenous, and we come from very different backgrounds. So what I'm showing here is that there are 14 groups that make up 95% of the U.S. Hispanic population. Among them, 6 Hispanic origin groups have populations greater than 100, and they're displayed here on the screen. The majority of Hispanics in the United States are comprised of Mexicans, which are about 64.6% of the U.S. Hispanics, followed by Puerto Ricans, Salvadorians, Cubans, Dominicans, Guatemalans, Colombians, and so forth, as you can see here on the screen. Beyond that, we also want to take into account Hispanic population by nativity, right? So whether they're foreign-born, native-born, and if they're foreign-born, how much of the U.S. population are U.S. citizens, and what size of them are not. So as you can see on the screen, we have approximately, and this is a comparison between 2000 and 2012. In 2000, we had approximately 64.5 were native-born, while 35.5% were foreign-born. And of the people that were foreign-born, 11.4% were citizens, while 24.1% were non-citizens. And you can see that there's been major shifts from 2012 and 2000 here. So non-citizens do comprise a large portion of the Hispanic population in the United States, while the majority still account for native-born, meaning that they were born in the United States and have citizenship, right? If at any point you want to access information that's specific to your state, Pew Hispanic Research is a great place to go to. I encourage you to go to www.pewhispanic.org/states/. And it's an awesome resource for you to find out what's going on with Hispanics within your state. And it looks something like this once you get to the website, and you can click on your state and find out more detailed information about your specific state. So you'll see that here we'll click on Nevada, and you can see a lot of detail about the general average ages, what the population looks like, things from marriage and births, economic status, health insurance, things like this. So it's a very awesome resource that's available to us through Hispanic Pew Research. So I encourage you all to access that as a means to get more information around Hispanics within your specific state. What I'm going to do now is I'm going to unmute the lines very quickly in case there's any questions about what we just talked about. And if not, we'll go ahead and get moving.
The conference has been unmuted.
So again, the lines are currently unmuted. Is there anything that anyone wants to pose a question on or make a general statement? You can do so over the phone now. Oh, if not, it's completely fine. If you're shy, you can go ahead and use the chat box. And again, we'll be answering your questions as we go through the webinar, if you decide to chat them in the chat box. Right? So I'm going to go ahead and mute the lines again so we can keep moving. What I'm going to do now
The conference has been muted.
is I'm going to introduce my colleague here, John Hellman, who's the Director of Advocacy here at the Latino Commission on AIDS, and he's going to walk us through Latinos and healthcare. So again, I want to welcome John and thank him for joining us today to give us some information on Latinos and healthcare in the United States and territories.
All right, thank you, Tony. So again, my name is John Hellman. I'm the Director of Advocacy here at the Commission, and I'm just going to briefly talk about some, I think, key information that we need to keep in mind when we think about healthcare for Latinos in the country. As we know, there's been a lot of advances in HIV/AIDS treatment. There's been a lot of new biomedical technologies for prevention efforts, and all of this is really, really great news, but we see that there's uneven, it looks very, very uneven when we think about the entire country, and that has a significant impact on Latinos depending on where you live in the country and where you were born. So we wanted just to provide some brief background information so that we could all just understand the issue in a little bit more complex way. And I think the first bit of information, which is something that many people have probably heard, that Latinos are the most uninsured in the entire country. In 2012, which was before the open enrollment period for the health exchanges, which happened late last year into early this year, 29% of the Hispanic population was not covered by health insurance. So no public insurance, no private insurance, no insurance at all. And so we want to keep this in mind because it has a significant impact on anyone's ability to not only access prevention services for people who are HIV negative, but to access treatment and care if you're HIV positive. But before we give a little bit more information, I want to unmute the lines again and just if I can get a few people to answer this question that's on the screen, what do you think prevents Latinos from accessing health care? And just again, if you don't want to answer on the phone, you can just type it in the box that's right in front of you and submit it when you're ready.
So we're going to unmute the line in case you want to speak, or you can decide to answer it in the chat box, right?
The conference has been unmuted.
I would say whether they're documented or undocumented in the country.
So immigration status, right? And then we also have Omar saying the cost, right? Very good point.
A lot of folks are saying immigration status and also deportations. A few folks have said trust. A lot of people are saying cost. The healthcare system. Yeah, so I think
language maybe, language barriers.
Language access is also very important. Thank you. Cultural sensitivity, knowledge, accessibility, education. So this is great. So this is a lot of the reasons why healthcare access can be very, very difficult for many people. So thank you for those who have responded. I think we're going to go ahead and mute the line so that we can continue.
The conference has been muted.
Okay, so like Tony mentioned in his last slide about Latinos over in this country, a lot of folks come from different subgroups depending on where they were born, whether it was in the United States or Puerto Rico or outside of the U.S. and territories, and they have different levels of citizenship. And I just wanted to make a note that just because you're a non-citizen doesn't mean that you're undocumented. There are lots of different ways that people are not citizens, they could be residents, they can have their green card, they can have varying visas. So I think it's important to know when you see non-citizen, it does not translate to undocumented, and that's a very, very important distinction. But in the slide that you have in front of you, and this gets a little bit more of a picture of different groups' experience with insurance, you see that primarily Mexicans and Central Americans are the most uninsured, and Puerto Ricans and Cubans have high levels of private insurance, which is insurance through your employer or private insurance that you purchase on your own, and public health insurance, which are things like Medicaid, Medicare, and other programs that some other states may offer. And as we know, because the news talks about it every single day, the Affordable Care Act, also known as Obamacare, has had a significant impact on how healthcare has access in some parts of the country and little to no impact in others. And I want to bring up two very, very important components of the Affordable Care Act, the first one being the health exchanges. Again, the enrollment period, the very, very first enrollment period ended earlier this year, and some states decided to make their own exchanges, like California, New Mexico, Oregon, New York, and other states decided not to do their own exchanges and asked the federal government to step in instead. Places like Texas, Arizona, Florida, the Carolinas, the Dakotas, etc. So this had a tremendous impact on the kinds of exchanges and what information they had access to. For some of the state-based exchanges, they were able to tailor their marketing, their information, their outreach efforts to the populations that they knew best. And for some of the states that did not choose to participate, it was just a federal-run exchange, so it was a little bit more difficult to have more tailored messages to the populations that needed it the most. And the second component to the implementation of the Affordable Care Act has been the expansion of the federal Medicaid program. For some states that already had a robust Medicaid program, it was an easy decision to expand Medicaid, like New York is a very good example of this. It was an obvious decision to do that. But for other states, similar states to what we discussed, that did not implement their own exchanges, states like Texas and Florida and the Carolinas did not expand Medicaid. So that affected a lot of people, which we'll talk about again in a little bit. And just to give you an overall sense of what the overall uninsured population looks like, this is data that's taken into account the open enrollment period that ended in, I think, at the end of March. And you'll see the darker shades of blue are where there are more uninsured people, and the lighter shades of blue are where there are less uninsured people. And it's no coincidence that the states that have expanded Medicaid and that have run their own exchanges tend to have less uninsured populations, and the states that did neither of those things have a lot more uninsured populations. And just for the sake of the webinar, because we're talking about Latinos, we're going to pick on three particular states. We're going to look at Florida, California, and Texas. Why these three states? Tony mentioned in his slides earlier that there were a group of states that contain most of the Latino population in the country, but these three states actually have more than half of all the Latinos in the country, and it just so happens that these three states have almost 60% of all the uninsured Latinos. Now, these three states don't represent every nuance and every particular thing that happens with uninsured Latinos across the country, but what's happening in these three states has a significant impact when we think about the overall state of health for Latino populations. So first, the easy one, which is California. In 2012, so this is before a lot of the implementation of the Affordable Care Act, there were 4 million uninsured Latinos, which was about 29% of the total uninsured population. And it's important to know that California had the most uninsured Latinos out of any state in the country, and California decided to expand Medicaid, which is known as Medi-Cal in California, and they operated their own exchange. And California was actually one of the few exchanges in the country that had an entire Spanish version of the Affordable Care Act, of the exchange rather, sorry about that. So they knew who the population they were trying to reach. They could tailor the messages for Latinos specifically, and even though, according to a lot of news articles, they didn't perform as well as they would like, they got almost 1 million Latinos to enroll either in qualified health plans or in their state Medicaid program, which is a big success. So moving on to the next slide, we're having some technical difficulties with the webinar, so we'll get the next slide. Oh, never mind, it's been established. So the next state that we're going to pick on is Florida, which has about 1.2 million uninsured Latinos, which represents 34% of the total uninsured population. They did not expand Medicaid, and they did not operate its own exchange. And it's really important to know, and a lot of groups within Florida and national groups made a big think about this. 200,000 Latinos missed a giant opportunity to be covered under Medicaid because Florida decided to not expand their own Medicaid program. And because they did not operate their own exchange and they weren't able to tailor it to suit the particular needs of their own state population, only 106,000 Latinos enrolled, which, if you do the math, there's still a little over 1 million Latinos that are uninsured in the state of Florida, and we know Florida is one of those states that have high rates of HIV infections and AIDS diagnoses. So this is a very, very important reality when we're thinking about HIV and AIDS in Florida in particular. And the situation in Texas is a little bit like Florida, but the numbers are a lot bigger. So I think I messed up on the slide here, but Texas actually has a little bit more than 1.2 million uninsured. I think it's actually around 3 million, and it's 39% of the total uninsured population. The second bullet is true. They did not expand Medicaid, which left out 583,000 Latinos. Now, this was the biggest missed opportunity when we look at Medicaid expansion across the country. Texas had the most Latinos that could have benefited, and it's important to note that people who qualify for Medicaid are generally people who are poor and have low incomes. So when we think about this number, that means that close to 600,000 poor Latinos do not have an easy way to access adequate, affordable health insurance. And Texas is also one of those states that did not operate its own exchange, and I can't think of the number right off the top of my head, but it's a very similar situation to Florida, that not a lot of Latinos enrolled in qualified health plans. So again, there's a lot of uninsured people still left in Texas, and although advocacy groups are trying to push Texas and the state legislature to do something, it's not likely that it's going to change anytime soon. So what does this mean? It means, like I've been saying a little bit already, that we need more awareness and we need more advocacy about the local issues in each state and even in each community about what it means to develop quality healthcare options, access, and infrastructure when we're thinking about Latinos and health in general, but in particular about HIV and AIDS. And I want to make a small point. Tony also mentioned that a lot of the Latino growth that we're seeing is in the southeast of the United States, and although the Latino populations compared to some of the bigger states are not as high, it happens to be some of those states where HIV infections are growing, Medicaid is not being expanded, and they're not participating in the exchange programs to be able to tailor to the needs of their uninsured or underinsured populations. So, think about what's going on in your state, what's going on in your communities, and think about what is needed in order to get better healthcare access for Latinos, no matter what health condition you're trying to prevent, or no matter what health condition someone is already experiencing and trying to get better health outcomes. So with that, I will turn it back over to Tony.
Great. Thanks, Sean, for that very concise yet very informative bit of information on Latinos and healthcare. So like John was mentioning, and like we talked about a second ago, there's plenty of factors that are influencing barriers or creating barriers for Latinos to access healthcare. Things like not having health insurance at all, or being distrustful of the healthcare system, so kind of having this tension about, what if I go there, and especially if I'm undocumented, like, there's this fear of deportation, or even if there are community services available that are free, whether that organization has the ability or cultural competency to be able to interact with me in a way where I feel comfortable. On top of that, there's situations where Latinos sometimes just don't really have an understanding of preventative medicine. How many times have we seen Latinos show up to the emergency room while they're near their deathbed? I mean, that's a cultural thing and behavior within the Latino community that sometimes needs to be addressed, right? So there's something going on the way Latinos in the United States are approaching and engaging in healthcare. And the reason why it's important for us to understand this, along with the piece that we mentioned in the beginning around growth, is because we need to understand what's going on so that we could then potentially include this somewhere or another, if we want to, within our National Latino AIDS Awareness Day events. Again, a lot of our National Latino AIDS Awareness Day events can be focused on HIV and AIDS, but some of them are directly informed by some of these, what we call social determinants, right? So their lack of knowledge, things around like transportation, right? All these things influence the way Latinos access healthcare, and guess what? They also influence the way Latinos are affected by HIV and AIDS. So not only is it important for us to understand how that's influencing the growing population of Latinos and Hispanics in the United States, but it's also important for us to understand how those factors are influencing the way Latinos are contracting HIV and why that's happening. So I want to start off similar to what we've done in the previous sections, is giving you guys a general bit of information that really puts into a capsule what's going on with Latinos and HIV, right? Among those who are HIV positive, CDC data indicate that over a third of Latinos, about 36%, were diagnosed with AIDS within 1 year of testing positive. By comparison, 31% of blacks and 32% of whites. What is this telling us? If we find out that about a third of Latinos are being diagnosed as having AIDS within 1 year of testing positive, what are Latinos doing or not doing that's causing this? And you can type that into your chat box, or maybe John can answer it. John, do you know what that is?
Well, I think something, and a few people mentioned this in their responses to the earlier question. If people don't have adequate access to even healthcare in general, then HIV/AIDS, which is an extremely important health condition, it's not going to come up because you're not engaging in healthcare systems. And for other people mentioned that there's people aren't testing.
And that's exactly the piece we're trying to get to, right? The reason why this is happening is because Latinos are testing late. They're finding out once they're in the emergency room, and they have all these other ailments that come around from having AIDS, that's causing them to then go to the emergency room because they're near very advanced stages of HIV, right? So they're testing late for HIV. They're not getting tested, which is an important piece for us to understand when we're comparing them, especially to other populations, right? So what's going on with HIV and AIDS across the United States? There's 10 states, and I'm going to read over the graph. It's the number of Latino adults, adolescents estimated to be living with an HIV diagnosis, and it's the top 10 states, and this is from 2010. As you can tell, this mirrors very closely some of those top 10 states that you saw that were directly impacted or had the largest population of Latinos. So the number of states that have the largest number of Latinos living with HIV are New York, California, Florida, Puerto Rico, Texas, New Jersey, Illinois, Pennsylvania, Massachusetts, and Arizona. These are the top 10 states that have a population, the top 10 states of the population that have a large number of Latinos living with HIV within that state, right? So, but another thing to note is just like we saw with the fastest growing rates of Latinos previously in the population, guess what's happening with the rates of HIV and AIDS? Those same states in the southern states, because populations, the Latino population have all these other barriers to accessing healthcare, guess where they're also increasing in rates of infection. And again, the number of people living with HIV isn't always the same as the rate in which they're becoming infected, right? So it's important for us to think about not only the number of people living with HIV, but also how fast Latinos are becoming infected, right? Because that's going to give us a glimpse as to how we might want to allocate resources or what we might need to do to prevent that rate from getting any higher. And for those of us that are more inclined to some sort of visual rather than graphs and numbers, I presented here the same information as before. The number of Hispanic Latinos persons living with HIV diagnosis in 2010 in a map. So you can see the darker the red, the more number of people living with Latinos living with HIV within that state, right? And again, this is information that we pulled directly from AgeView. AgeView is an awesome resource, and similar to what we were able to do previously, where we were able to click on each individual state and get information about Latinos within that state, you could also do that with AgeView and get very detailed information about what's going on with HIV and AIDS within that state, and even more specifically, within your county. So I really encourage you all to go to the AgeView website and access information, because it really gives you a lot of information on what's going on with HIV and AIDS in your state, and you can be very detailed about it, whether you want to see a particular transmission category, or whether you want to do the number of cases, or the percentage of cases, new diagnosis, and you can also do county. So this is an awesome tool that's available for people to access to see what's going on with HIV and AIDS within your state and even county. Now, if we're talking about the way in which Latinos, the transmission categories, the way in which Latinos are becoming infected, we separate them here between males and females, so Latinos and Latinas. And this is information from 2011. So you can see where do we see the burden of, when it comes to males, how are most Latino men becoming infected? And you can type that into your chat box. What's the majority? What transmission category is holding? Exactly. Erica just told us MSM contact. That's exactly right. It's MSM contact. And MSM is another way of saying, it's a public health term that we oftentimes use in the field, which stands for men who have sex with men. So that's MSM. 79% of Latinos are getting diagnosed through MSM contact, followed by heterosexual contact, and then intravenous drug use. And the fourth category is men who have sex with men and also engaging in intravenous drug use. And while we look at Latinas, that looks very different, right? We see the majority of Latinas becoming infected through heterosexual contact, about 86%, and about 14% of Latinos becoming infected through intravenous drug use. So this gives us an idea of how Latinos in the United States are becoming infected with HIV, right? And for those of us that have seen this before, the continuum of care, it really revolutionized the way we approached HIV prevention and treatment in the United States. What this graph here shows is it broke it down by race and ethnicity. So you see this category here is for Black African Americans, this one is Hispanic Latinos, and this one's white. For those of us that aren't familiar with the continuum of care, it really, again, like I said a minute ago, it revolutionized the way we approach HIV, because we saw that out of 100 people that are HIV positive, and Latinos, only about 80% of them knew they were positive. From that number, only 67% of them were linked to care, meaning that they went to see a doctor about that. And then only 37 were retaining care, meaning that they were seeing a doctor regularly for their HIV care and treatment, right? Only 33% from there were prescribed treatment, so they started taking treatment for their HIV/AIDS diagnoses. And finally, only 26% reached viral suppression. And again, the reason why viral suppression is so important is because we now know if someone is virally suppressed, the likelihood of them transmitting the virus to someone else is ridiculously reduced. So this is why you hear the term prevention with positives now, is because we understand that if we treat someone that's positive, find out that they're positive, put them in treatment, engage them in care, and they can get to a place where they're virally suppressed, meaning that there's less of the virus in their body by taking medication, it really reduces the chances of them transmitting the virus to someone else. So this is what it looks like for Latinos in the United States, right? But on top of that, we have something called because of Gardner-Sketsky that we saw here, or the continuum of care, this influenced the national HIV/AIDS strategy. And the National HIV/AIDS Strategy pretty much outlined the way the United States was going to address HIV within the country and territory, within the states and territories, right? So there were several goals that were outlined by the National HIV/AIDS Strategy. And the goals are seen here, right, on the side, by the colors. One of the goals was prevent new HIV infections. A second goal was improve access to HIV care and health outcomes. And the last one was reduce HIV-related health disparities. And within each goal, we had very clear objectives that were outlined with numbers and percentages. So what the CDC produced was this progress report at a glance, what you see here. And the progress report pretty much told us, how are we doing with the National HIV/AIDS Strategy? How are we reaching the numbers that we want to reach, right? So from this, guess what we're seeing? The populations where Latinos are being specifically mentioned, we're not always meeting the marker. We're not on the way to meet that target expected number by 2015, which is when the National HIV/AIDS Strategy said it would like to have these goals and objectives met by. So here we see that reduce new HIV infections among groups at increased risk by 25%. That's not happening with Latinos and Hispanics. Increase linkage to HIV medical care among racial groups to 85% or greater. And the goal was changed from 75 to 85, so it was higher. But guess what? It wasn't being met with Latinos and Hispanics. On the bright side, when it came to increased viral suppression among specific groups by at least 20%, we are meeting that marker with Latinos and Hispanics. Again, all this information is useful for us to understand what's going on with Latinos in the United States as far as the population and growth, but also how are they accessing health care, why are they not accessing health care, and how is that then influencing the diagnosis rate, how many Latinos and Hispanics are living with HIV, how are we doing it as far as approaching Latinos to make sure that they're receiving care. And one thing that's been mentioned that I think it's important to highlight, in order for Latinos to get to viral suppression, they need to have access to health care. But if you see the large majority, about a quarter of Latinos in the United States are undocumented, guess what? That 25% doesn't have access to private insurance through the marketplace because they just can't access it. That's the way it was been created. So that's an obvious structural policy level where Latinos are greatly impacted. So they're relying then on community level support when it comes to their HIV/AIDS treatment and medical care. So with that, I know we threw a lot of information at you, but I really wanted to give you guys a comprehensive idea from census information to health care to HIV and AIDS information around what's going on with Latinos. And obviously, there's a reason why we need to focus on Latinos and Hispanics in the United States. We comprise a large number of the United States as a population, but there's obvious barriers that currently exist to the way we're accessing healthcare, which is then directly impacting the rates of infection that Latinos are encountering with HIV and AIDS, and the way in which we need to deliver services, especially in those areas where Latinos are growing at a faster rate, in those areas in the South, where a lot of the organizations that are trying to provide services are having a very difficult time to build infrastructure to be able to address their needs in a way that's most effective. So this gives a lot of ideas as far as how we might be able to craft our National Latino AIDS Awareness Day event, or what type of information you might want to provide at our National Latino AIDS Awareness Day event to address some of these barriers and ultimately see greater outcomes, right? So again, what I'm going to do now is I'm going to unmute the lines to allow you to pose a question, or you can also pose the question using the chat box.
The conference has been unmuted.
Would anyone like to make a statement or pose a question, you can do so by talking on the phone now.
Okay.
Sounds like it was a questions. We did an awesome job.
Yo necesito saber qué plata me queda para ver si...
Erica Thomas mentioned, I know that access to quality health care is part of the problem with Latinos knowing their HIV status. And she also mentioned how about things like stigma and discrimination. Thank you for bringing that up. Those are things that the National HIV Strategy try to address as well. That we need to take into consideration as organizations.
Thank you.
You're welcome. Also, things that we want to make sure that we address when we're crafting our National Latino AIDS Awareness Day campaign. Stigma and discrimination are obvious social situations that are influencing the way in which Latinos are becoming infected, much like they are a large number of other populations that are directly being affected disproportionately by HIV and AIDS. So, Erica, thank you for bringing up that comment and statement. That's very true. Anyone else have any other comments or questions to make? We will be sending out the PowerPoint shortly after the webinar. And again, I thank you all for joining us today. A lot of the information I think would be useful for you all to sit down and maybe view it on your own time in a little more detail. And after doing that, you have any particular question or you have a comment that you'd like to make directly, or on how it might inform your National Latino AIDS Awareness Day event, do so by emailing me at tochoa@latinoaids.org or calling me directly here at the office at 212-675-3288. And again, the information is now on your screen, or screen. And another service that we currently have available is capacity building assistance. If you're a community-based organization and would like support around how to better do outreach amongst to Latinos for testing, or how to better create something within our organization as far as programs go for Latinos or testing, or any type of organizational infrastructure situation that you want to have us help you with, we can do so through capacity building. And it's very customized and it's completely free. And we're here to help you out in any way we can to do that. So please, I encourage you to reach out to me to access the service. And it could be through a training, through a very customized direct webinar with you, through any which way you feel is best suited for you to make sure that your programs function better to address the needs of Latinos or any population for that matter, or any transmission category that you might have or might be working with. So we're here to support you in that way. And again, you can contact me directly by accessing the information on the screen now at 212-675-3288, extension 337, or emailing me. You'll probably get a faster response from me over email just because I'm not always at my desk. And being that National Latino AIDS Awareness Day is only a couple weeks away, it'd be easiest to kind of get me via email when I'm not at the office. Okay? So with that said, I'm going to thank you all for joining us today. And if there's any questions that come up or any statements that you'd like to discuss with me, you can do so contacting me over email or give me a call. All right? Thank you all for joining us.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Thank you.
Thank you. Please stand by.